Ketamine is a powerful drug with anesthetic properties. It was developed in the 1960s and quickly gained acceptance in human and veterinary medicine. Originally intended for surgical procedures, ketamine induces a trance-like state while providing pain relief and sedation. It's vital to remember that ketamine is a potent substance with potential risks, even when used in medical settings. Despite its medical applications, ketamine is increasingly abused recreationally. This essay will delve into the dark side of ketamine, exploring its dangers and the potential consequences of its misuse. Understanding these risks is crucial, given the drug's increasing presence in non-medical settings. Ketamine's dissociative effects have made it a popular choice for recreational drug use. This trend is particularly noticeable in nightlife settings, where the drug's ability to alter perception and create a sense of detachment is highly sought after. Users often report feeling detached from their bodies and experiencing vivid hallucinations. These effects can be both visually and emotionally intense, creating an otherworldly experience that many find appealing. This state, often described as a K-hole, is highly sought after in recreational settings. The sensation of being in a K-hole can vary greatly, from feeling like you're floating to experiencing complete sensory detachment. The drug is typically snorted as a powder but can also be injected or consumed orally. Each method of consumption carries its own risks and potential for harm, making it crucial for users to understand the dangers involved. The allure of experiencing a dissociative high has led to a concerning rise in recreational ketamine use. Social settings like parties and raves often become hotspots for experimentation, as peer pressure and the desire for new experiences drive individuals to try the drug. The drug's unpredictable nature and the significant risks associated with its use make it a dangerous choice for those seeking recreational highs. Adverse effects can range from mild disorientation to severe psychological distress, and in some cases, medical emergencies. Despite the dangers, ketamine use continues to rise, particularly among young adults and teenagers, highlighting a critical need for increased awareness. Education and open conversations about the risks of ketamine are essential in combating this dangerous trend and protecting vulnerable populations. Even in the short term, ketamine use carries significant risks. Users may experience nausea, vomiting, and dizziness immediately after consumption. The drug can also cause hallucinations, paranoia, and anxiety, leading to unpredictable and potentially dangerous behavior. One of the most immediate dangers of ketamine is its impact on breathing and heart rate. Ketamine can depress respiratory function and cause irregular heartbeats, potentially leading to life-threatening situations. These effects are exacerbated when ketamine is mixed with other drugs or alcohol. The unpredictable nature of these short-term effects makes ketamine a risky proposition, even for first-time users, as the drug can affect individuals differently. The long-term effects of ketamine use are equally concerning. Regular use can lead to chronic bladder problems, including inflammation and pain. There is also growing evidence linking long-term ketamine use to cognitive impairment, including memory loss and difficulty concentrating. The drug's impact on the brain is not fully understood, but studies suggest potential damage to brain cells and function. Beyond the physical risks, chronic ketamine use can severely impact mental health. Users may experience depression, anxiety, and even psychotic episodes. These psychological effects can linger long after ketamine use is discontinued, underscoring the drug's potential for long-term harm. Section 5. Ketamine Addiction, a growing concern. Ketamine, originally developed as an anesthetic, has found its way into recreational use, leading to a growing concern about its addictive potential. While not everyone who uses ketamine becomes addicted, the drug carries a significant risk of dependence. Its dissociative effects can be alluring, making users feel detached from reality, which can be particularly appealing to those seeking an escape. Regular users may develop a tolerance, requiring higher doses to achieve the desired effects. This tolerance can build up quickly, leading individuals to consume more of the drug, increasing the risk of addiction. This cycle of increasing use can quickly lead to addiction. The more frequently ketamine is used, the more the brain becomes reliant on it to function normally, creating a dangerous dependency. Withdrawal symptoms, including cravings, anxiety, and insomnia, can be intense, making it challenging for individuals to stop using ketamine without professional help. These symptoms can be both physically and mentally exhausting, often leading to a relapse. The addictive potential of ketamine is a significant concern, as overcoming dependence often requires extensive medical and psychological support. Treatment plans typically involve a combination of medication, therapy, and support groups to address both the physical and psychological aspects of addiction. The drug's ability to create both physical and psychological dependence underscores the importance of seeking help if you or someone you know is struggling with ketamine addiction. Early intervention can make a significant difference in recovery outcomes, highlighting the need for awareness and accessible treatment options. Section 6. Medical uses: a narrow scope. While ketamine has legitimate medical uses, these are limited to specific situations under strict medical supervision. It is used as an anesthetic in certain surgical procedures, particularly in emergency settings and for patients who may not tolerate other types of anesthesia. Ketamine has also shown promise in treating severe depression and chronic pain when other treatments have failed. However, it's crucial to emphasize that these medical applications are carefully controlled and monitored. Self-treating with ketamine is extremely dangerous and potentially fatal. The risks associated with recreational ketamine use far outweigh any perceived benefits. Section 7. Case Study: the tragic case of Emily. The dangers of ketamine are not merely hypothetical, they are a harsh reality for many individuals and their families. This is not just a story, it's a wake-up call for everyone. Take, for instance, the tragic case of Emily, a bright and promising college student who experimented with ketamine at a party. She was known for her vibrant personality and academic excellence, making her loss even more heartbreaking. Emily experienced a severe reaction to the drug, leading to respiratory arrest and ultimately her untimely death. The emergency medical team did everything they could, but it was too late. Emily's story is a stark reminder of the potential consequences of ketamine use. Her memorial was filled with flowers, candles, and heartfelt messages from those who loved her. What began as a night of experimentation ended in tragedy, leaving her family and friends devastated. The grief was palpable as they struggled to come to terms with the sudden loss. Emily's story underscores the critical need for increased awareness about the risks associated with this seemingly innocuous drug. It serves as a powerful reminder that even one night of experimentation can have irreversible consequences. We must educate and inform to prevent more tragedies like Emily's. Section 8. The importance of dosage and purity. The dangers of ketamine are further amplified by the lack of control over dosage and purity in non-medical settings. Ketamine sold on the black market is often cut with other substances, making it impossible to know the exact composition and potency of what is being consumed. This uncertainty significantly increases the risk of overdose and adverse reactions. Even small variations in dosage can have significant effects on the body, making it extremely difficult to gauge a safe amount of ketamine to consume. The unpredictable nature of street ketamine, coupled with the potential for contamination, highlights the extreme risks associated with its non-medical use. Section 9. Seeking help, resources and support. If you or someone you know is struggling with ketamine addiction, seeking help is crucial. Numerous resources are available to provide support and guidance on the road to recovery. Addiction treatment centers specialize in addressing substance abuse disorders, offering detoxification, therapy, and relapse prevention programs. Support groups, such as Narcotics Anonymous, provide a safe and supportive environment for individuals in recovery. Remember, seeking help is a sign of strength, and recovery is possible with the right support and resources. Section 10. Legal consequences, possession and use. It's important to be aware of the legal ramifications associated with ketamine. Possession or use of ketamine without a prescription is illegal in many countries, including the United States. The penalties for ketamine-related offenses vary depending on the jurisdiction and the severity of the crime. These penalties may include fines, probation, or even imprisonment. Understanding the legal consequences of ketamine possession and use can serve as a deterrent and encourage individuals to seek safer, legal alternatives. Section 11. Conclusion: the high cost of ketamine. Ketamine, a powerful anesthetic with limited medical applications, poses significant risks when used recreationally. The short-term dangers, including respiratory depression and unpredictable psychological effects, can be life-threatening. Long-term use is associated with a range of health issues, from bladder problems and cognitive impairment to addiction and mental health disorders. The allure of a dissociative high comes at a steep price. Emily's tragic story, a stark reminder of the potential consequences, underscores the importance of awareness, education, and informed decision-making. By understanding the risks associated with ketamine, we can work together to prevent future tragedies and promote the well-being of individuals and communities.